This is my audience. What would you do if a family member was victim to a disease that caused the body to weaken and lose coordination? According to the Parkinson's Foundation of the National Capital Area, 1 million people in the United States are affected by Parkinson's disease and roughly 6 million worldwide. Parkinson's disease is the second most neurodegenerative disease in the world. In this speech, I will be telling you about the mechanism of the disease, the cause, history, prognosis, and treatment. So what is the mechanism of Parkinson's disease and how does it affect the body? Parkinson's disease is a disease that involves malfunction and death of the nerve cells in your brain called neurons. These neurons produce dopamine, which is a neurotransmitter that controls coordination and movement. If the nerve cells or neurons that are dead in your brain, then your brain will produce enough levels of dopamine, which will cause loss of coordination and movement. How is Parkinson's disease diagnosed? A doctor will perform a neurological examination to see if you have the symptoms of Parkinson's disease. There is no test that will guarantee that you have it. In this examination, he will see if your arms have tremors, or when you walk and you're pulled back, if you can regain your balance. How is Parkinson's disease caused? Some experts say it's genetics, environmental, or a combination of both. The genes that are mutated that may be linked to Parkinson's disease are PINK1, LRRK2, and DJ1. About 15 to 25% of people with Parkinson's disease admit to having a relative with the disease. Studies have shown that patients who have immediate family members with Parkinson's disease are 4 to 9% higher to have a chance to develop the disease, according to the Parkinson's Disease Foundation that was recently been updated in 2015. Another way that it could be caused is environmental. It has been said that being exposed to environmental toxin and injury could cause Parkinson's disease, and it has been linked that rural living, well water, and pesticides could also cause it. According to the Parkinson's Disease Foundation, in 2009, the U.S. Department of Veterans Affairs added Parkinson's to the list of diseases possibly associated with exposure to Agent Orange. How did Parkinson's get its name? Parkinson's disease was the first formally recognized in James Parkinson's An Essay on Shaken Palsy, which was published in 1987, according to Krisha McCoy's article, The History of Parkinson's Disease, which was medically reviewed by Pat F. Bass III, MD. The first treatments were in 1940 to 1950, where there was a surgery on the basal ganglia, which resulted in improvements of Parkinson's disease. While this surgery was effective, it was a rather risky surgery because 12% of the people died as a result of the operation. Parkinson's disease is a terminal disease. It does not cause death right away, but living with it can cause you to die because it's terminal. There are 4 stages of Parkinson's disease, or 5 stages of Parkinson's disease. The first stage is symptoms can only affect one side of the body. The second stage begins affecting both sides of the body and your balance is still intact. The third stage is symptoms are mild to moderate, but your balance is impaired. Stage 4 is the patient is severely disabled but can walk with no assistance. In stage 5, the patient is wheelchair bound or bedridden unless being helped. There is also a loss of motor function. Loss of dopamine means loss of coordination and movement, which causes Parkinson's disease and the stages to become worse. There is no cure for Parkinson's disease, and Parkinson's disease is terminal, but there are medications that can help treat your symptoms. Levodopa is a medication that can temporarily restore dopamine action in the brain, which can keep your coordination and movement going. The Parkinson's disease future doesn't look so good because the research is still going on to find a cure, as there isn't one. As you can see, victims of Parkinson's disease begin to suffer big time, especially due to loss of coordination and movement. Hopefully soon there is a cure for this terminal disease. And here's my audience.